human longevity is very rooted in science, and you talked about some studies, and I think there's over 20 different scientific journals and papers that's been written by your leadership team. Tell me a little bit about the science behind human longevity.
Absolutely. Yeah. And to your point, I mean, it's actually 60 plus peer reviewed journal articles, and it's quite a bit. Um, because we are so steeped in science, I think one thing that is so important to human longevity is that, we actually have talked about this. It's not about sensationalism, it's about the science of it. And so for us to have that, we would have to have studies. We would want to really track someone's health over time and look at whether if we did implement something, whether that intervention actually changed the clinical course, right? That's what kind of evidence medicine really looks at, and then isolating certain factors to see what's significant or not. So
Mhm.
science to us is important in the sense that if we are truly to change medicine, which we really want to, in the sense, not that, again, I don't want to say that conventional medicine is bad, it's not, but for certain key factors, like for trauma and acute issues
Mhm.
or life-threatening issues, conventional medicine is, there's nothing better than that. But when we're looking at like longevity care, and we are nowadays living longer and longer, and we want that kind of health span and lifespan gap to actually be narrow, meaning we want people to be really functional, enjoying life, traveling and having fun and exercising right up until whenever their life ends, instead of it being like the last 10 years they're sickly. Like, we don't want that. So we want to close that gap between health span and lifespan. We really need to have the science to help support not just people's internal beliefs that this is important, because we want that as well, but also to change the community of medicine to understand that this is important. Meaning, we need, ultimately, to democratize this, we need insurance buy-in, we need government buy-in, we need other healthcare institutions to acknowledge the importance of this, things like that. And that really can't happen in medicine unless you have strong science. I will say, I think because of the fact that we are so robust in science, this also explains why we're co-branded with Mass General. And Mass General is such a strong historical entity of science and standard of care that, I do think it speaks volumes that they are co-branding with us and working with us, and we have this partnership where we can see this kind of medicine continue to grow. And I do think it's important for us to do that with conventional care, because only by doing that can we grow in parallel, where it's symbiotic and complementary.
Mhm.
Because if you try to split off and do things completely differently and there's no communication, ultimately this is not the kind of medicine that will be able to be survivable in the field of science and medicine, nor will it benefit people the most if two arenas of medicine are conflicting or at odds. So I think the ultimate way for everybody to really benefit from this kind of medicine in the future is for us to be able to have an understanding and a mutual respect in all of the versions of medicine together, so that patients in the future, clients, people, can utilize the best of both worlds without there being some sort of conflict that one side is not talking to the other or not believing in the other.